All right. Good afternoon, everyone. I am James Kitchen. I serve as Special Assistant to County Executive Pittman, and I will be moderating today's webinar. Thank you for joining us for this first webinar in Season 2 of our Engage Arundel webinar series, Community Wellbeing in Anne Arundel County, How Data Can Help Us Build Stronger Communities. Engage Arundel is designed to foster collaboration and communication between the government and the community. The initiative combines online and in-person events and resources to empower residents with the tools and knowledge to create sustainable and thriving neighborhoods with the help of county resources. Before we begin, I would like to quickly go over some housekeeping items to ensure the session runs smoothly. First, please note that today's webinar is being recorded. So if you need to step away or if you would like to review the content later, we will be sending out a recording after the event. A copy of the presentation will also be provided. If you have any questions during the presentation, please use the Q&A feature located at the bottom of your Zoom window to record your question. And we will then host a question and answer session after the presentation is done, and we will get through as many questions as possible. So thank you again for joining us. And now I'd like to introduce the ArundelStat team, who will be our guest presenters for this session. So first we have Elizabeth Funch. She is the director of ArundelStat, which is the performance and analytics team for the county. Before joining us during County Executive Pittman's first term, she worked as a senior analyst for the county stat team in Prince George's County, where she oversaw the process for monitoring and shaping government to be more efficient and productive. Elizabeth has over a decade of experience in evaluating programs at the state of Maryland's Department of Mental Health and Hygiene, as well as the PEMA Prevention Partnership in Arizona. Next, we have Neri Ordaz. Neri is an ArundelStat analyst and an experienced statistical analyst and has managed customer service experience in the financial sector and worked to improve customer interactions at every touch point. As a language learner, Neri spent years working internationally and worked at a market research firm and developed her skills in survey design and implementation, analyzing trends and root cause analysis. And finally, we have Alex Resny. Alex is also an analyst with ArundelStat. She most recently worked as staff auditor for Maryland's Office of Legislative Audits, where she evaluated a variety of state organizations for compliance with the state and federal laws and organizations. And now over to you, Elizabeth.
I need to unmute myself. Thank you, James, for that introduction. And thank all of you for joining us today. We are really excited to be here and to show off this new tool. I'm going to take a minute. So right now our agenda, we have it's a short agenda, but it's full of lots of useful information. We have a little bit on the background. We're going to look at the index contents and what it contains. We're going to take a minute and explore the index, and then we're going to provide some examples of how you as community members and community leaders could use the index to help support your own work. So as James said, I am the director of ArundelStat, and a few years ago, my team was looking for a way to better understand where gaps in the county are so that we can make sure that we were deploying our resources to areas that were most needed and where there would be the most impact. We reached out to Asha Smith. Asha is the director of the Office of Equity and Human Rights and asked them if they could collaborate with us on this project. So since 2021, the Office of Equity and Human Rights has been responsible for the creation of a county-wide strategy for advancing equity in the county, in county departments and throughout the county. Our departments are concerned with providing residents with meaningful access to county programs, resources, and services. And one of the key tenets of equity work is that it is data-driven. In considering how to approach the question of equity, we have to consider how our residents are doing. How do we know how they're doing? What do we know about the relative experiences of various demographic groups and regions? And what information or data do we have to make those decisions? For those of you who work in data, and we do, there is a lot of data in the universe, but it's not always helpful to decision makers unless it is accessible. In the absence of accessible data, a lot of what we do is based on our hunches and the word on the street. You know, this anecdotal evidence really depends on who has access to it and the different experiences they have. In order to assess how our residents are experience the county across demographic groups, we do need data. So my team collaborated with OEHR to identify data that loosely reflects the social determinants of health. Social determinants of health tell us a lot about the health and well-being of a community. They were developed to identify and measure extrinsic factors. So those factors that are beyond individual choices or healthcare access that significantly impact people's health. We've used broad categories in our index of safety, health, prosperity, and access to start off, as we felt these were a solid foundation and a good place to start. So once my team disaggregated the data, it was mapped to make it accessible. Our hope is that the community and government leaders will use this tool to inform their decisions about the allocation of county resources. We hope that it will allow community members who want to improve their own outcomes and their neighbors' outcomes to see what is missing and what is possible. Asha, did you want to add anything?
I don't. That was a great overview, and thank you for that.
Thank you. So we are really looking forward to see how our community members will end up using this tool, you know, as they support their own interests or requests or causes. So with that, I'm going to turn it over to Alex and Neri so that they can go through the index and show you this amazing work.
Great, thank you. I'm Alex. I'm one of the analysts. So I'm going to talk a little bit about what's actually in the index, and then I'll pass it over to Neri, who's going to show you the fun part, which is the index itself. So what's in the index? This is not a new concept. This is something a lot of other counties and cities have. And so we started by looking at what other counties and cities had to see what we thought worked best for our county. And so we considered what did they include in their indexes, what did they look like, and all of them included maps and measures that reflected the well-being of their residents. If you want to look at some, there's some as close as Montgomery County or Alexandria. We ended up modeling a lot off of Tacoma, Washington, but they're all very interesting and slightly different. So ours boiled down to these 4 categories: prosperity, access, health, and security. And you can see the measures included in each of those categories on this slide. We are hoping to expand over time. And so if there are things you'd like to see, feel free to use that Q&A to give us some ideas and things to keep an eye out for in coming years, because we want this to be as useful and well-rounded as possible. So you can see in prosperity, we have homeownership, we have income, we have poverty rate, we have housing cost burden, which is you're spending more than 30% of your income on housing. Educational attainment, which is high school or equivalent. Under access, we have childcare, so number of childcare spots or number of children per childcare spot. Vehicle access, grocery store access, language access, which is English fluency, and broadband or internet access. Under health, you can see we have life expectancy, we have physical and mental health. Both of those are self-reported, and it's asking residents, how often did you feel you had not good or poor mental or physical health in the past 30 days? Health insurance, and then under security, you can see we have crime and we have natural hazards. Most of these came from the census. We love the census. Thank you for asking all the important questions. There are a few that we couldn't get from the census, so those are included here. Just some to highlight. The national hazard risks comes from FEMA. The food access comes from the FDA. And then there's a childcare desert map from the Center for American Progress that was really helpful in developing the childcare layer. So I'm going to pass it over now to Neri, who's going to walk through the actual index.
Okay, thank you, Alex. So I'm gonna go ahead and share my screen. Okay, so How do you access the index? First is you can either type into your search bar, Google Community Wellbeing Index in Arundel County, and it will pop up. Or if you often go to the AA County website, you can go ahead up to the top right-hand corner where it says Open Arundel. And Open Arundel is just a collection of tools, a lot of the public information that we have in terms of dashboards regarding police, public safety, government operations, land use is there. And there is now a new card for the Community Wellbeing Index. So you'll click on the Community Wellbeing Index and it takes you to the landing page. And it goes over what Alex just mentioned, which is what are the 4 categories. Now, what is the other things we also have on this site is a little bit about how to use. So if you, after this, still have questions, want to share with someone else, feel free to go ahead and look at these. Also in the frequently asked questions, we also have links to the data sets that Alex just mentioned. So if you have questions about how median income and natural hazards, you can go ahead and click on these links and it will send you to the original data source. So once you're here, we're going to go ahead and explore the index. And when you click explore the index, a lovely splash screen is going to pop up and it just talks again about the 4 categories. There's a little disclaimer there and we're going to go ahead and get started. So when you land here, this is just a lot of text. And then again, it's talking about what is the index, what are the metrics included in it. Talks about that it's at the census tract level that was specifically designed for that reason. And then we also have how to navigate. We understand not everyone is going to be familiar with this tool. So we do have how to navigate, right? What does this mean? What are the functions? Also on the left-hand side, you also have the help here. So if you have questions about what these icons mean, you can also see it there. And then we get to the overall Community Wellbeing Index. So the overall Community Wellbeing Index is a aggregate of all the measures, right? All the categories and all the metrics that we have. And so here we see the county and we see that there are different parts of the county that are lighter green to darker green. And here when we look at the Community Wellbeing Index for all the categories, the range for this is from 65.7 to 100, which means that the lightest colored census tract is 65.7% as well off as the darkest colored census tract. So when we look at this, we can see how it is dispersed throughout the county. And when we get into specific ones, whether it's physical health, mental health, you're going to see how the colors change and how it looks in different parts of the county. No matter where you are at in the Community Wellbeing Index, if you click on it, you will see the census tract name along with what is the value for the index for each category. Okay, and then we're gonna go ahead. We also have options to layer on demographic data. So we have Black, African American, Hispanic, Latino, those over the age 65. That is another way that you can interact with the data as well, is seeing where that tends to be in the county. And we're going to go ahead and scroll down to Educational Attainment Index. And so again, this looks different from the average overall. And we see here that the Educational Attainment Index ranges from 70.7 to 100. So this means that the residents in the lightest colored census tract are 70.7% as well off as those in the darker ones. So 70.4% of residents have a high school diploma, whereas those in the darker have 99.6, whereas the countywide is 93.8. So again, here, when you click on the census tract, you're going to see not only the index value, but now for each individual one, you're going to see what is the actual raw value. So the index was put on a scale from 0 to 100. And so for every single one, we did provide what is the index and then what is the raw value, because people are going to want to know, what does this mean? So again, this is just one way where you can see how each part of the county looks different, and we're going to go from there. Another nice aspect we have here is comparing across metrics. So one of the other things with regards to the Community Wellbeing Index is a lot of these factors are not single, right? They often relate to each other very well. And so, for example, we have some maps where you can slide between the homeownership index and the housing cost burden index. So you can see, okay, this part of, let's say the county, let me click one right here. And I'm going to see what is the homeownership value for this census tract, excuse me. And here we see that the homeownership is 50.2. And then if I go over and I click in the housing cost burden, I'm going to see that the housing cost burden is 67.54. And then for the raw values, I see what is that value for those who rent and those who are owners. So again, in terms of looking at this, I can see who are those people in the county that own their homes, and then who are those that are more cost burdened in terms of renting or even owning. So these are just some of the ones that we have where you can slide and toggle between them. We also have median income versus educational attainment. We have health insurance versus physical health. And we're gonna go ahead, and if you want to go ahead and start layering more data, whether it's zip codes, sorry, county council districts, I was trying to remember that. You're gonna come back to the left-hand side and you're gonna click on one of the 4 categories and you're gonna get another splash screen. And again, it's gonna tell you what are the metrics inside. And here, this is where you're going to be able to layer data. So if you wanna look at how does this look like with zip codes, you can go ahead and layer that on top. If you want to look at council districts, you can also do that as well. If you're interested in the older population, right, over age 65, you can also layer that on top. Now, what is neat about here is in the search, you can either type in an actual address or just a location name. So if I type in Crofton Library, it's going to take me to the library, and then I'll see what census tract it is, and I can do that. Or let's say I'm interested in a specific address, I can also type it in. So again, in terms of finding your location in a county, very easy, whether you want to choose a census tract, whether you want to type in your address, and so on. On the left-hand side, you're also going to see a bar chart, and it has the past rates over the year, so you can see how the county is trending. Another neat thing about this side of the Community Wellbeing Index is you can go ahead and let's say you're interested in a specific area. Alex is going to get a little bit more into this, but let's say I live in this part of the county. I want to learn more about my area around me. We see that the county average is 74.6. But if I'm interested in this particular area, I can go ahead and lasso, and I see that it changes. So now that this area has a different percentage and it's lower than what was before. So this is another way that you can interact with the Community Wellbeing Index. And then lastly, 2 more things. We have measures by race. So because this is on the census tract level, we are not able to dig deep into race for every single census tract. So here we have the homeownership rates, most of the measures for the county broken down by race. So if that is something that you're interested in, this is where you can look at it. And then the last thing that I do want to talk about is side-by-side maps. This is just another really cool feature where let's say you're interested in access for a certain part. You are going to be able to compare internet, English fluency, vehicle access, childcare access, and grocery store access. And this is really just to show that just because maybe one part of the census or the census tract isn't doing so great in one doesn't mean it's all bad, right? There are different levels of access for different things. So sorry if it's going a little slow, but once you zoom in, you can click on one census tract across the different measures, and then you'll see what is the rate, what is the raw value. We also have the county average, so you can then see, are you above the average, below the average? How are you doing in terms of that? And then there's also another tab for frequently asked questions, which is also available on the website. But that, in a nutshell, is the Community Wellbeing Index. There are it is a lot of information, but we are going to go ahead and show you how to use it. So I'm going to pass it over to Alex.
Yay. Okay. I'm going to reshare my screen. Hold on. Neri, will you stop sharing yours just so it doesn't share multiple screens at once? Which, by the way, is not a thing I knew it could do. Turns out it can. Okay, here we go. Haha. Okay. So now for the part we hope will be most useful to you, which is that we want residents to use the index primarily for advocacy, for grant writing, to learn more about their communities, and to really hold decision makers accountable. We want you to be able to substantiate need in grant writing and in advocacy by using these maps. We want you to be able to learn about the area around your home or your church or your schools by looking at the index. And we want you to be able to enter into conversations with decision makers or at county council with your own data and with your own information that really levels the playing field between you and the folks who do this all day, every day for their job. So I'm going to go through a couple of case studies. The case studies are in a document that was linked where you joined the webinar. You don't need that, but if you would like it, it has all of the directions of how we're going to go through this, and it might be helpful after the fact to look at. I really encourage you to follow along on your screen to sort of click and play and get familiar with the index as you feel comfortable. So you can follow the steps Neri outlined before. You can search Anne Arundel Community Wellbeing Index. You can also go to aacounty.org/openarundel/wellbeing-index, and it will take you here. I don't think the chat allows me to send the link. I think it would just send it to the panelists, which is useless, I think. But if there's a way to send it out, I know my fearless panelists will help me do that. So once you get here, you're going to click the big red box that says Explore the Index. And we will jump into our first case study. So our first case study is that you're advocating for your community to have additional funding for childcare spots. You want to use the index to support that claim that you need that extra funding. So we know we're looking at access. So on the left-hand side, we're going to go ahead and click on the tab for access. Then we know we want childcare access. So along the bottom, we're going to look for the button that says childcare and move to that tab. So again, to get here, we went from aacounty.org, Open Arundel, Wellbeing Index. We hit Explore the Index. We clicked Access on the left and Childcare on the bottom. First thing we're going to do is look at what the county-wide average is. So on average, there are 5.7 children per childcare spot in the county. So obviously this is an area of need for our county. And for this case study, we're going to be looking at the area around Northeast Middle School. So we're going to hit that magnifying glass in the top right corner, and we're going to search for Northeast Middle School. Obviously, you would put in whatever area you're actually advocating for, but for our example, we'll do this. So magnifying glass, Northeast Middle School. So what you can do is you can click on this census tract and it'll update. So now we know there's 11.5 children per childcare spot here. That's about twice what we have for the county. So if you're just advocating for this census tract, or maybe the one right next to it too, because they're really close, they have the same need, right? We have about twice the need for childcare access here as we do the rest of the county. We can also zoom out if we want to advocate for a larger area. So we can use this minus button at the bottom right of the map and zoom out. I'm going to close this. And we can now use the lasso tool to select a larger area. So see the line with the dots on the end, we're going to click on that, and we'll loop the entire area we're interested in advocating for. And then we'll see that this updates. So now we know there's about 8.2 children per childcare spot. So something else that could be useful here also is if you're looking for childcare for your child, you can find that there are areas around this area, right, which clearly doesn't have a ton of childcare, but there are darker green areas surrounding. So if you're looking for a spot, maybe it's better to look in one of these census tracts where there are fewer children than there are spots. So it could also help direct your individual search. So that is our first case study. Our second one's going to be grant writing. So you're going to be applying for a grant that provides funds for low-income zip codes in the county. You work in zip code 21225, and you want to support that this zip code needs additional or deserves this grant. So in this case, we're looking at prosperity since we're looking at income. So we're going to click on the prosperity tab on the left. Then along the bottom, we're looking for income. So we're going to click on that. Again, we clicked prosperity on the left and income on the bottom. So in this case, we need to look at zip codes. And as we've discussed, this covers census tracts. So we're going to need to add the layer for zip codes. So to add a layer in the top right corner, you're going to click on this stack of boxes. And we're going to come all the way down to the one that says zip codes. And we're going to click the little eyeball. And that'll pop in the zip codes. Okay, so again, we want prosperity, income. Then we use the stack of boxes to add zip codes. So now we're going to zoom in, again, minus and plus at the bottom. You can also use the scroll on your mouse if you have a mouse. And we have zip code 21225. One tricky thing about using zip codes on these maps is census tracts and zip codes have overlap, but they're not exactly perfect. And so when you use this, you might have to add the caveat that it is zip codes in 21225, which may not perfectly align with that zip code. But again, we'll use this lasso tool. You see the line with the 2 dots. And we're going to lasso zip code 21225 since that's the zip code we are entering for this grant. And we'll see that now the average household income dropped to about $80,000, which is much lower than the average median income for the county. All right, we're going to do one more case study. You are involved in a community organization, could be the PTA, an HOA, a church, and you just want to know more about the area you live in and that you serve. You don't know exactly what you're looking for, you just want to know more about your area. And so if I want to just learn about my area, not specific to any specific metric, what I'm going to use is the View the Data Side by Side tab. So this is the second one from the bottom, View the Data Side by Side. And we can just do prosperity since it's the first one that loads. But you can see all of the different categories are at the bottom. So you could do this for each different option. And on these, this is the slowest loading tab since it has so many maps. So we are patient with him. You can use the plus sign to zoom in and it'll zoom all of them at the same time. So I'm gonna go ahead and do that twice. And we're just gonna pick a census tract to focus on. Let's do this one. This one's an easy one to click. I'm changing it up from what the document says. That's not right. Okay. And you can make sure you click the right census tract by looking at the name. So you can see the name is the same all the way across. And what we're seeing at the bottom is averages for the county. So now we can compare this census tract against the county average. So here we have this census tract has 98% homeowners. That's way above the average for the county. We can see that the median household income here is about $95,000. That's below average for the county. We can see that about 77% of our renters are cost burdened. That's above average. But our owners are not very cost burdened at all, only about 4% compared to 17%. So you have more homeowners, a lower median income. Those who are renters are facing a high cost burden. We can look at poverty. So we have a higher than average poverty rate compared to the county. And we can look at educational attainment. About 80.8% of people living here have a high school or equivalent compared to 94% for the county. And so when we want to learn more about our area, we could do this for safety, for health, for access. And you could learn, maybe we need some more language support. Maybe we need more access to grocery stores, but it would help you sort of figure out the nuances of your census tract in terms of what your census tract is thriving in and where your census tract could use additional support. So that is all we have for you today. If you use the Wellbeing Index, we would love to hear about it. So please send us an email with how you've used it and also how we can make it better for you. I've already seen a few in the chat that are really great ideas of things we'd want to add. But that is our presentation for today.
All right. Thank you so much. So if you have questions, you can keep putting your questions in the Q&A and we can read some of those and have them live answered. You can also use the raise hand function on Zoom if you would like, and we can give you access to actually say your question out loud. So be thinking about the questions you want to ask here. While we're doing that, I do want to just make everyone aware that we do have Asha Smith on the call as well to help answer questions. So ArundelStat team did the presentation, but this was a collaboration between ArundelStat and the Office of Equity and Human Rights. So Asha Smith is the director of our Office of Equity and Human Rights. She's an attorney, and a human resources professional with a wealth of compliance experience in federal, state, and local equal employment opportunity and disability laws. Her experience includes developing and implementing policy, investigating and resolving internal complaints, facilitating staff training, and providing advice to senior personnel. So thank you very much, Asha, for being here with us as well. I do not see any hands raised, and so I am going to start reading through some of the questions. Oh, we got one here. Leslie, I think you should have the ability to talk now if you'd like to unmute yourself and ask your question.
Yes, hi, good afternoon, and thanks for having this presentation. And it looks like a very valuable or value-added tool. So I'm interested in kind of exploring and working with it. My most fervent concern, though, is the mobility access for the Davidsonville area. Mobility services, I had moved from Baltimore County, having taken care of my mother there for several years, back to Anne Arundel, where I had raised my children and lived for over 30 some years. All that being said, I had to undergo surgery for my knee replacement and such, and the mobility services here are beyond abysmal. And I don't say that lightly. The MDOT services in Baltimore County were extraordinary. And so the services here are very limited to the routes they have designed. The Davidsonville area has very little access to anything, and paratransit has a 3-week kind of waiting list in order to even get a doctor's appointment access. And that's not according to the transportation report, which I read thoroughly from last year, and I still have it up in front of me. So I have grave concern. Were those kinds of stats put in for actually persons with disability, the aging of those communities, and how mobility transportation services would be needed futuristically and are needed now?
All right. Thank you for that question. So I think the question, what was really, how was mobility services and other services for older adults or people with abilities included into this index? Neri or Alex, can you speak a little bit to that?
Yeah, we wanted to include transportation in the index, and we looked at a lot of different sources. And unfortunately, the data right now is really focused on like metropolitan areas. So we could get data for like Annapolis, but in the more rural areas of the county, there was just nothing available. And so we went and talked to transportation and said, like, this looks like something we need to develop on our own if we want to include it in the index, which we do. And so that's something they're working on, that we're hoping in the next iteration we will have how far the residents live from their closest transit stop. And then I think what you're saying also is a really good up level to that, which is we need to build in mobility to that as well. So I will add that to our radar, that's what we want to be aiming for next time.
All right. Thank you. I'm going to move some to we've answered some of the questions that were done during the Q&A function, through the Q&A function, but there were a handful of questions on, hey, can we add this environmental tool? Can we add this other data to it? And it looks like we're open to expanding this like as we move forward. Is that accurate?
Yeah, we definitely want to add more.
All right.
If we can.
Yep. So give us your feedback if you think of something that could be useful to this. Keep that stuff coming in. That would be great. We've got a question from Adam saying we're not seeing roads. Did we include any kind of? Adam, do you mean roads as just like to identify where you are, like on the map, or are we talking some sort of like traffic congestion, accident type layer? Road satisfaction. He asked that. How are resident road satisfactions incorporated into this index? Is that something that we have in it now?
That is also not something we have yet. I can talk to transportation about that as well to see if that's something that they have. Again, one of the caveats we have for data in this is that we want it to be available for all census tracts. Obviously, we wouldn't want to put you know, like if we're only measuring road satisfaction in Annapolis, then Annapolis's score gets plummeted and everyone else stays the same, even if their roads are not better. And so that is one of the things that hold us back from adding new data, is we have to make sure all census tracts have data available. So that's something else I can talk to them about and see if that would be feasible.
Awesome. Thank you. With respect to the childcare access data, is the children data point all children or just those in need of a childcare spot?
Just children of an age where they would be in childcare, if that makes sense. And I'm gonna drop right now the link to that data source. There's a couple in here also I'm seeing that are like, you know, where did this data come from? The FAQ page on either the index itself or the page before where it sends you to the FAQ has a full list of all of the data sources and it links out to all of them. And so you'll see the definition of what does broadband mean. And then you'll also see a link to the original data where we got it. And I can send that link also in a response.
Yeah, and I think I saw a question about downloading it. So the links will send you to where you can download it.
Awesome. So I think that handles, yep. So some of those questions coming in. All right. So it looks like we have a question from Ralph about animal layers too. Collect animal data, produce statistics on independent. Okay, that's interesting. Let's see if there's a question in here. That looks pretty cool though. Can we integrate with citydata.com? Is that something we're able to do?
I know nothing about citydata.com, but I will research and I will find out if that's something that we can do.
All right, perfect. John has a question. I take it that the time series, like salaries and house prices, are expressed in dollars, are not current, and in current dollars, not constant dollars. Does the database have a means of transforming time series into constant dollars?
That is not something we have in the current one. So the idea for this is like that it's a snapshot in time. One thing we do want to look at as we add to the index and we keep updating it each year is, are we seeing gaps increase or decrease? And obviously that's where that would come in. So in future iterations, we'll probably have to, like you're saying, make it inflation adjusted. But since it's currently just a snapshot in time, everything is in current dollars.
All right. And then Michael Bargman has his hand up, so you should have the ability to unmute now and ask your question.
I just want to tell you about city data. It's used about 14 million times a month, and what it is, it's a analysis from varieties of government and private sources from everything from, say, weather patterns to crime to you name it. How many females versus males, income data. I used it when I used to work for the federal government in policy and planning. It just has every type of breakdown you can possibly use on any type of zip code. And it's a plethora of information. You can really go down the rabbit hole on that one. So just letting you
I
know.
love a rabbit hole, so thank you for this. This is going to be very interesting to look at, because one of the things we've also discussed is census tract best or would zip code be more useful? So this sounds like something that would be really helpful for us in maybe adding some more zip code level data.
Awesome. Thank you. And in one of the questions that was asked and then answered in writing on the Q&A was about how other departments use this. Kurt had asked specifically whether the budget office was involved in the creation of this tool. Asha, can you just share with everybody how we're working with departments
Sure.
with the utilization of this?
So the budget office wasn't directly involved in the development of the tool, but one of the things that the ArundelStat team considered is how individual departments could use the tool, obviously, in making their decisions as they govern and as they lead. And so the budget office and all of our departments have actually received an overview of the tool, technical assistance is available for them, and they actually have the ability to incorporate internal data layers that are more specific to the work that they do so that they can customize the experience that they have for their particular subject matter area. And so that's how we're working, actually, not just with the budget department, but with all of our departments.
Awesome. Thank you. I am going through. I think we've gotten to most of these questions. Does anyone have any other questions for our ArundelStat team or for Asha on this tool? Again, you can either raise your hand or you can type your answer into the Q&A function. All right. Well, not seeing any more, I just want to say thank you to both our presenters, to Asha, and for everyone for joining us today. We hope you enjoyed this webinar and found it useful, and we encourage you to, tune in to Engage Arundel. We'll have these coming out every month, so be sure to look for the notice on the webinar that we will do in October. But thank you all and have a great rest of your day.
Thank you.